Grazie per avermi dato la parola.
Thank you for giving me the floor. This is a very demanding task.
Fare il punto della situazione. Ma innanzitutto
First of all,
siamo all'inizio di
we are at the beginning
un percorso di grandissimo interesse.
we are at the beginning of a path which is of great interest, which is that of marriage between internet and health.
Il passaggio alla sanità.
So the transfer to higher communication.
Dicevo prima, scherzando,
I was saying to our colleague Lella, joking, we have to abandon informatics and move on to internet, because computer science was way back in the 80s and 90s. Now we are really living in the era of internet, and this is a difficult transfer that we have to understand, because it will change the way we provide health care. Just to give you an example, I've looked at the different tablets. You see here, I've opened my FSE, my file, my health file, what we mentioned before. And this is mine, and I am a patient of the Emilia-Romagna region, and here we automatically have, through the internet, all health data of my interactions with the National Health Service. They come through the internet and they reach my file, and this is a reality for many citizens in Emilia-Romagna. That is for about 4.5 million citizens. This is the result of a work of 8 years, and this is a network that follows the directives that were mentioned before by the representative from the Ministry of Health, and this is why we have this electronic file. This is the real transfer. This is the real. We have to forget all the old computerization. That was one aspect of the networks that we now have to plan and interconnect and make operative at national level. So technology on the internet and else, well, you know, it needs hardware, software, and connectivity. There's nothing else. Then hardware changes continuously. We invent all new aspects. Connectivity probably becomes more and more accessible, particularly on the Wi-Fi. We are lagging behind with respect to more advanced countries, and software is gradually being updated. This is one aspect of the web. The network includes people. Imagine internet without the people. It would be just a series of cables. We can't even think of internet without technologies, as we would have 800 million looking at the stars. They can't be connected, but we cannot even imagine internet without people and without the culture of internet. And so the culture of internet has to become the culture of health is highly different from the old computerized culture that was based on the data manager and a whole series of profiles that today risk almost being an obstacle to the new culture of internet. This is the iPad, where I already have access to my electronic health file. And this means this is a sort of Google in the health field, but it also reaches where Google cannot reach, because it traces all the bit information that concern me and that are present in the National Health Service, from the practitioner, public hospitals, and since we are within Aiop and now in Emilia-Romagna, it's also connected with, we have it also in Lombardy. We have linked also the accredited private healthcare is also connected. And I think that all type of healthcare must be included in this file, citizens' file. The chemists and the whole clinical life is really built up in my page, my homepage, because today we do reach our homepage of the National Health Service, homepage of the regional councilship, of the ministry, of the clinics. We cannot go further on, but we need, every citizen must be able to report within its electronic file all those health data that regard him and that are included in the different repositories of the different healthcare systems, or are still on paper. And this is an interesting aspect, because the yields of the new millennium is unidimensional. We have gone through three phases: the three-dimensional aspect of things, the bidimensional aspect of paper, which is the phase of bureaucracy, of certificates, of the 20th century, of the paper file. And now we are going through a unidimensional phase, which is that of bits, and the possibility of creating dematerialization for all the health data, because we are going through this dematerialization. And the second phase of dematerialization, just please consider that Kelly in his last book says that 40% of exports to the US are dematerialized, of all the exports. Also, care paths are also dematerialized, because all information bits needed for my treatment are included in this electronic health file and are found in the different pathology networks according to the needs. This is not a big invention, and I remember Star Trek. Do you remember that TV series of the 80s that dematerializes its data and rematerializes them on the abstract? And then it was Stephen Hawkins that was the consultant, and he had been the consultant for that video, and then it does appear in a small part of that film. There's this fundamental idea that we can dematerialize also the health care paths and rematerialize in another place. Of course, we will no longer buy a bicycle in the future. We shall buy the electronic file of the bicycle. We materialize it again when we reach our final destination. So automotive manufacturers don't want to sell a car, but find that you can customize and you materialize it when you need it. And this will also happen in the care. We shall increasingly customize our care. But how can we do it? With this electronic data file. And this is not an electronic version of the old bureaucracy, old paper documents, maybe in Excel. But this is a dematerialization of all data that in the future will appear like a hologram. We must forget the old document also in the electronic format, but let us look at interesting issues. Now, let us move on to a new era. And I'm very happy to be here in an assembly of the private sector, because this distinction between public and private will not make much difference in the future. What will be the added value is the integration of these sectors. So this is the file. I showed it on the iPad, and this is the page that I reached. Of course, that was mine. I had my name. I'm presenting something that's already working in the Emilia-Romagna region, and to a different extent, in a different way. It's already working also in the Milan region, in the Trentino Alto Adige region. This is my homepage of the regional system. At this point, there is a door. It's like Alice in Wonderland when she asked for the key to get into the garden. So we need the key and the password. In Lombardy, they already distributed to everybody a card with a chip for access. That's an old tool. We will go beyond that, but today it's a bit safer than a password. In Emilia-Romagna, we are distributing the password to all citizens. Now I go beyond that, and I go into my page. After that door, everyone has its own health file. And this is mine. Nobody else can go penetrate this. There were the directives of the warrantor of privacy, and this says that only thanks to the citizen consent, data can be circulated on the internet or showed to doctors and shared with professionals, either with the practitioner or somebody else. And this is what is being used in Emilia-Romagna, which is not much different from that of Lombardy. Do you see that it said load your documents? So I automatically receive all documents, all data. Let us explain that on the network we only have bit data. There are no syringes, there are no sandwiches of paper, just data and information of the bit or byte type. So I launched the research in this case, and I hope often with the new directives of the Ministry to guarantee interoperability also with foreign countries. And I look at all data in the public sector, my interactions, and I hope soon this will also be integrated by the private sector. So whenever a person needs some counseling, needs some medical advice because he has a problem, there is a doctor that has the most sophisticated diagnostic techniques to identify bits on his body, to probe it, to penetrate it, to take a picture with magnetic resonance, but that's the doctor that tries to extrapolate all the bits he can from the body of that person. The Foucault says clinical was developed to close a person in a department, even on a bed, and be able to observe him, because the past, there is a low communication past, so communication, in order to provide the high care intensity, they had to keep him 1 week, 1 month within a department. It would be like buying a Fiat car, the Lingotto, and have it as customized as possible and stay there 1 month. So here we reach all the bits of this interaction. I went to the family practitioner, I went to a lab for a test, I was hospitalized, I went to the emergency unit. This was already said before, so this file collects all data. Kevin Kelly says in 5 or 6 years' time, we probably think that it's impossible to remember how to live without being connected with the internet. All our health data will be interconnected with the internet. And in the health file, the patient's records, we have a summary document, what they call USSI, which is all data needed for that moment. So the clinical life of that person, the child will have all data of his whole life. But in order to operate, I need data that are actualized by the practitioner that continuously updates them. So the family doctor generates an electronic medical record. So with here too, with that updates it continues keeping this electronic medical record updated. It is because this record must be used and used quite easily. This is the architecture that we developed in Emilia-Romagna. This is an IELTS horizontal line. This is contains all health data. This is also should be used in prospect also in perspective also by the private health sector. At the beginning, it was said that this electronic medical record is not only a health record, it must also be a social health record, also must be filled in by the social workers. But so these are all data that the citizens agrees that could be entered. Well, we should also know that maybe a person not only is ill, but maybe does not have any relatives supporting him or lives in poor conditions. This is a slide on the net. What have we done? We have created a net on the internet that stores, gathers, and processes all data on the internet with the consent of the person involved. We have 8,500 experts and hospital doctors are already connected together with also 4,000 practitioners, so that all reports contribute in making this electronic medical record. I tried to describe the situation, and I must reach the conclusions. I don't have time to describe all this. This is reality, and it also follows the directives and the guidelines of the ministry. Data are ordered. There are links, health services. There is also a health. Also home assistant.
Poi materializzare in percorsi di cura questi dati.
For all this material which is dematerialized and included in this record. And the whole health service will work in this way, and this will be through collaboration between health and private and public health service, and data will increase as one ages. I have many other slides, but I will leave them for the proceedings of this conference. This is how all data are collected and redistributed for the record. And so what is the situation that we have at present? This shows that all European countries are carrying out different projects. This is the Ipsos, or the IPSA countries for the Italian regions. It's a common electronic prescription. But just to end here, this is the general picture, which is created directly in contact with the different operators, which is not built from a bureaucratic point of view. We have 3 regions at an advanced phase: Lombardy, Emilia-Romagna, Trentino, Alto Adige. We have other regions that have implemented the technological platforms that are needed to operate this big dematerialization and data collection in bits. And we have 2 models. One is the Lombardy model that has given results, and with heavy technological infrastructure. This is more expensive, and with an internet portal. So this goes to the portal and downloads data. And of course, I dealt for many years with the booking service. The model of Emilia-Romagna has a light technological infrastructure because this is integrated. We integrated all files of practitioners through an integrated structure, and particularly a My Page that is providing a web domicile to all citizens. So the citizens will then decide, according to the rank center, whether this data will the data will be made available, of course, of the practitioner, but also for others. I've ended so far, and we are in a new cultural era, the era of the internet, the era of high communication. A health of high communication, that of the old millennium, which has also been a millennium where bureaucracy, certainly the paper played an important role, maybe also positive respect to the previous period, but we must now leave it behind us, and we must live with enthusiasm through this era, because there's great involvement of operators and citizens with a more direct interaction of patients with the doctors, and it gives great opportunities of providing health care to citizens that require more and more this competence, this service.